Senator Booker, thank you for holding this important hearing. And I guess I would start with you, Dr. Burnett. And I think you know that our marijuana was first classified as a Scheduled I drug in 1970. And could you talk about how the medical field's understanding of marijuana changed since it was classified as a Schedule I drug in 1970?
Certainly, Senator Klobuchar. If I could make one point about this exact time period, there was a entire commission, the Schaefer Commission, which actually recommended that the scheduling of cannabis not be put into Schedule I because there would result a significant amount of arrests for individuals or American citizens. And so this is exactly what has happened since that time. But just getting right back to your question, the medical community, because of the Schedule I status, basically has its hands tied around being able to understand the therapeutic potential of the cannabis plant. As I mentioned before, universities are not able to appropriately fund research to understand the pharmacological and therapeutic benefits that are potentially within the cannabis plant. And, that has largely caused a lot of physicians to be able to take a hands-off approach on this. But there are, a select group of physicians that, especially as states have rolled out medical cannabis, who have begun to hear from their patients directly around the benefits.
We're one of those states in Minnesota, and of course we have incredible research institutions, and the same thing that you've said. Yeah. Even when it's legalized for medical reasons, the classification gets in the way of the research.
Exactly.
Especially, and we think about things like Alzheimer's, cancer, you name it. Then I think I'll turn to I think I'll ask you this, Dr. Burnett, actually.
Okay.
So we know there are significant disparities in the way our marijuana laws have been enforced. Even though Americans of all races use marijuana at similar rates, Black Americans are more than 3 times more likely to be arrested for possessing marijuana. This is one of the reasons I support the legalization and efforts to expunge prior nonviolent offenses, which I know you've discussed. Can you talk about the long-term impact this federal criminalization has?
Yeah, I think it further perpetuates the wealth and inequality gaps that I know many of the senators here are concerned about, right? If you have a criminal record, as Mr. Angelos talked about, you are incredibly held back from being able to make economic gains, participate in society in an honest way, and that increases the level of recidivism. And so, we've got a disproportionate amount of resources being poured into communities of color for law enforcement, and instead of economic development, and that's why you see the disparity that you see today.
Mm-hmm. Very good. And Mr. Angelos, I know Senator Padilla asked you a question about how this can affect people's lives, a conviction for this, but could you talk about why it's important to expunge certain prior offenses and that should be part of any effort to decriminalize it?
As I mentioned earlier, the lack of expungement prevents true participation in society. Having a felony conviction on my record when I got out prevented me from getting a good job. Even with the full presidential pardon, I still couldn't get an apartment because it comes up. And a kind of a funny story, I was invited to the Biden administration at the White House, and I almost didn't get in because
You're invited for like an event or something?
To talk about cannabis convictions and clemency. And so the fact that I'm going there to discuss this and I almost didn't get in because of a conviction that's been pardoned still comes up, and despite 12 previous White House admissions. And so expungement's extremely important.
Okay, very good. Anything you want to add to this discussion, Chief?
No, I heard something that struck me, and many times I have discussions with my officers and investigators, and a Schedule I drug has no medicinal use. And I'm quite often asked the question if, on one hand, we hear that marijuana helps support glaucoma, certain types of cancer, that's medical. So why is it still a Schedule I, which indicates that it has no medicinal use in the United States of America? So I think that that's a point that definitely needs to be cleared up, because we're sending mixed messages that on one hand it does have some medical qualities, but on the other hand it's classified as a Schedule I.
Exactly. Thank you. I guess one last question on that, Dr. Burnett. Many of our veterans, of course, suffer from conditions like chronic pain. And under current law, VA physicians aren't allowed to recommend or even discuss medical marijuana. I'm a co-sponsor of Senator Schatz's bill that would allow VA physicians to tell interested veterans about medical marijuana treatment options. Could you talk about how these limits harm veterans dealing with pain and PTSD?
And totally. I think that I have a number of colleagues. I mean, Dr. Susisley comes to mind, who's done extensive research on the potential therapeutic benefits of cannabis for PTSD, and the fact that there's a muzzle on VA doctors, probably calls into question their First Amendment right to be able to speak freely, but that's the nature of the VA. And so, it very much is a challenge for our, war veterans who served bravely overseas to be able to have to come back and get suboptimal care or have our options limited based on their veteran status.
Okay, thank you very much. Thank you, Mr. Chair. Wonderful hearing.
Thank you very much. Before I start my question, I just want to put into the record our CRS, Congressional Research Service report last month that talked about that marijuana trafficking from Mexican cartels has decreased and will continue to decrease as a result of the growing legal market in the United States. I also, gentlemen, you're coming towards the end. I'm going to ask my 5 minutes, defer to the ranking member for a few last questions. I'll follow up with a few last questions. Then the record will stay open. We'll ask more questions, I'm sure, and senators who have had their schedules drawn in many different directions, I have a feeling are going to want to submit questions for the record, okay? So I'll